Okay, now we talk about HCV diagnosis and treatment standards in China. Two of the organizations of Chinese Medicine Association at the Liver Disease Branch and Infectious Disease Branch was published the Prevention and Treatment Guideline of Hepatitis C in 2004, referring to APASL, NIH, and EASL recommendations. The guideline defined determination of acute and chronic HCV, made the criteria for ELISA HCV RNA and viral load testing method. Treatment consists of the combination of interferon and ribavirin. Yes, hard to read. Standard patient follow-up. And HCV prevention strategies in China. We have 3 strategies in China for HCV prevention control. First one is to guarantee blood safety and control HCV blood transfusion. So China started to carry out transfusing HCV antibody testing in 1992. In recent years, China has strengthened legislation, increased investigation efforts, and informed blood station construction so as to enhance its capabilities to test HCV, HBV, HIV, and other diseases. No compensation voluntary blood donations are implemented across the country. These measures help guarantee blood safety and help control transmission of HCV through transfusion and blood products. The second one is strengthening the supervision and management of disinfection operations in hospitals. China has realized that such problems as no standard operations indicate disinfection still exists in medical operations such as gastroenterological and dialysis. Sorry. Yeah. We are continuously strengthening the supervision and management over the disinfection operations in a hospital to lower iatrogenic transmission of HCV. Maybe some words were confusing. And the third strategy is integrated HIV and HCV prevention resources. In recent years, China has integrated HIV and HCV prevention and control resources, raised HCV awareness, providing clean syringes, prescribing methadone, promoting condom using amongst ideal MSM and the FSW, and effort to encourage people to be timely tested when a sexual disease is found. These efforts are made to decrease transmission of HCV through sharing, screening. Sorry. Syringes. Okay, syringes and sexual contact. Okay, the last one. It's very difficult to read some words. Okay, challenges. We have 5 challenges in China. The first one is to raise public awareness about HCV, lack of an established case-finding referral treatment system. To educate the public about HCV transmission. This includes increasing HCV testing awareness and enhancing the confidence that HCV can be cured. There are still many HCV cases remaining unconfirmed in China, but there are many diagnosed HCV patients who cannot be treated in standard ways. Integrating medical resources of the communities, hospitals, and blood stations, timely transferring the discovered cases into treatment and establishing the case-finding referring treatment system will be the important task and challenges for China. To provide effective and accessible treatment in rural and remote areas of China, access to HCV treatment is comparatively low for financial reasons and limitations of testing equipment and technologies. The problem of HCV detection during window period. HCV RNA testing has not been fully implemented in the blood transfusion system yet, because the window period still exists and means transfusion still brings the risk of being effective. Discrimination. China laws have stipulated that people with hepatitis has the same right to work, but in the real life, they cannot go to work. They may still have to contaminating obstacles. It is objective to get a grasp through this conference of situation in other countries and of ways to lower liver disease and discrimination. Chinese medicine to play an active role. And Chinese medicine are able to achieve very good effects on regulating liver functions and raising hepatitis C activities, but they cannot be used to replace antivirus treatment. There are a number of potential HCV cases in China that has not been diagnosed but are taking Chinese medicine to treat their liver disease. How to correctly guide them so that they can play an active, how to read this word? Yeah. Adjuvant. Okay, sorry. Thank you. Play an active adjuvant role will be an important task ahead. Okay. Yeah. So, just share about the two different researches in China. The first one is we did research maybe 50 years ago. It's about general populations. And the second investigation, just in 2008, we target the high-risk groups, but we didn't get national data yet. And also, we talk about the 3 strategies for HCV prevention and control and 5 challenges in China. So, any comments, any suggestions, any questions you will ask Dr. Zhao Donghui. Thank you.